Some women experience altered sensations in their ears, ringing in their ears, hearing loss, and other ear-related issues such as dizziness with the menopausal transition. Today we are discussing ear health and changes that can come at this stage of life. You're listening to Menopause Natural Solutions. This is episode 191. Welcome to Menopause Natural Solutions, your podcast for all things perimenopause, menopause and beyond. Stay tuned as your host, naturopath Jennifer Harrington, explains how to use natural therapies to find your ultimate health and happiness during your transition. Hi, I'm your host Jen. Thank you for your company today as we explore ear health. You may not be aware that you have estrogen receptors in your inner ear. Wherever estrogen receptors are located, you may experience a change in function as this hormone fluctuates. Some women experience altered sensations in their ears, things like ringing in their ears, hearing loss, and other ear-related issues such as dizziness. The reason I'm talking about this today is because I'm one of these women. I've recently been diagnosed with adult-onset eustachian tube defect, and due to this, I've been experiencing the sensation of fullness and pressure within the ear and hearing difficulties in my left ear. Although it's not painful, it's uncomfortable and it's extremely frustrating. In case you don't know, the eustachian tube links the back of your throat to your middle ear. So I've been researching and discovering the link between this developing now and the menopausal transition. Please know menopause isn't the only reason why it can develop at this stage of life. Anything that inflames or irritates the eustachian tube can be linked. So things like sinus infections, oral infections, think teeth and gums, allergies, pollution, cigarette smoke, TMJ dysfunction, or even the presence of nasal polyps. That being said, please see your primary care doctor or an ENT specialist to help you determine your cause if you're also going through this. In regards to ear health, there are a few common issues that can occur at this stage of life. The first one is dry ears. Dryness is a common occurrence with the menopausal transition. Many women notice that certain areas of their body become drier, such as their skin, their hair, their nails, eyes, mouth, and you can add the nasal cavity and the ears to the list as well. Ear itch. Having dry ears can produce the frustrating sensation of itch. No matter how intense this sensation gets, please don't insert anything into your ears to scratch. Changes in hearing. This is where it gets interesting. Some women will experience sensitivity to sounds and find the world too noisy, while other women will notice a reduction in hearing, especially high-pitched sounds like children's voices. Ear fullness or ear pressure. Eustachian tube defects come in here. The eustachian tube has three main tasks: middle ear protection from infections, middle ear ventilation, and middle ear drainage. In my case, I have a build-up of fluid that is trapped and I can't unblock or pop my ear, so the air pressure builds up, producing the sensation of fullness. Perimenopause is also a time of increased allergies due to the estrogen-histamine link, and allergies certainly can cause eustachian tube issues. Tinnitus has been described as the sensation of buzzing or ringing in your ear, but it could also be a hissing, a humming, roaring, or kind of mechanical sound. It can occur for many reasons, such as exposure to loud noise, head injury, jaw misalignment, and many more. But one possibility I want to bring to your attention is hormone therapy. Research has linked HRT use with various hearing issues, including tinnitus. This is not a reason to stop your medication, but it's a link that I wanted to bring to your attention because if you started experiencing tinnitus or other hearing-related issues after you started taking HRT, please go back to your doctor and discuss this with them. Dizziness. Falling estrogen levels can cause the mucous membranes within the inner ear to dry out. Inner ear disturbances can be linked to feeling dizzy and triggering vertigo. Many ears disease is an extreme example of this, where the woman may be temporarily bedbound from the intensity of the dizziness. Please don't despair. No matter what is going on with your ears, there are things you can do to help improve your situation. As a common theme at menopause is dryness, a systemic dryness that also affects your ears. I would start by looking at systemic factors that could benefit your entire body, not just your ears. And this starts with hydration. Are you drinking enough water? Could you benefit by taking an electrolyte product? Are you consuming enough beneficial oils? All of the omega oils are important here, but omega-7 shines the brightest. Omega-7 is found in sea buckthorn, salmon, anchovies, macadamia nuts, olives, and you can even find smaller amounts in avocado too. Moisturizing ear oils also exist, but don't consider this route if you have a ruptured eardrum. The best ones are infused with herbal medicine. Olive oil with added vitamin E is most often used as a base, with some common herbs infused into this. The most popular choices contain herbs like golden seal, mullein, and garlic. Golden seal is a very soothing, cooling, hydrating, and healing herb, with the added benefits of being antibacterial and anti-inflammatory. Mullein helps resolve swelling, relieve ear itch, and treat minor infections. It is also antibacterial and anti-inflammatory. Garlic is a stronger antimicrobial, and it can help ease ear pain due to swelling and infections. Other commonly used herbs in ear oils include calendula, yarrow, and marshmallow. Now don't forget about your sinuses. Having a blocked sinus can cause a buildup of fluid in your ear. Try daily nasal rinses or nasal sprays if your sinuses are impacting your ears. You will also need to assess any dietary or environmental allergens. Sore throats also need addressing and throat infections avoided. Many women find gargling with salty water effective. See your dentist to rule out teeth and gum issues. The saltwater rinse mentioned above may help, but oil pulling is a step up. Place a tablespoon of oil in your mouth. Coconut oil is the most frequently used oil, but you could also use sesame seed oil. Pour the oil through your teeth. Swish it around your mouth for about 10 minutes. When you are finished, spit it into an old tin or jar. Do not spit it down the sink. Remember, coconut oil is a solid at room temperature and you don't want to block your drains. Then clean your teeth as usual afterwards. Teeth cleaning should include flossing, brushing, and tongue scraping at a minimum. But the thing that has personally brought me the most instant relief is chiropractic treatment. If relevant for you, your chiropractor can do an eustachian tube release, which for me instantly unblocks my ear and provides relief from the internal pressure built up. Okay, it might not be the most pleasant adjustment, but the relief it provides me is well worth it. While at the chiros, get them to check your jaw alignment, as TMJ dysfunction is a significant contributor to ear issues. Any underlying chronic health complaint you have that is not well managed can be producing inflammation that may affect your ears. The main conditions linked here include anxiety, depression, insomnia, migraines, diabetes, hypertension, thyroid dysfunction, and autoimmune conditions. Reach out if you need a hand settling them down. I'm now around the 2-3 month mark since my ear really started to play up. These days it's intermittent and milder than before, but not gone altogether. I'm sticking to my plan and seeing really positive results. If your ears are frustrating you, don't live with it. You don't want to risk long-term hearing implications. I've given you some suggestions for where to get started, and I'm also more than happy to chat with you directly if you book a discovery call. That's it from me this week. Until next time, bye for now. Thank you for listening to Menopause Natural Solutions. This podcast contains general information about menopause. It is provided as a guide, and it is not intended to replace medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. If you have enjoyed today's episode, please share it with a friend.